Do you know how many women who die every year from breast cancer? And do you know that breast cancer can actually be treated if detected on time? If you do, you should cultivate the habit of examining your breast every month as a woman. Hello guys, and welcome back to my YouTube channel. My name is Nkiruka. So in today's video, I'm going to be sharing with you how to perform breast self-examination. Okay, I'm going to be showing you not just how to perform it, but things to look out for when you are performing it, what is normal and what is abnormal. Okay, so do well to watch this video from beginning to end so you don't miss anything that I'm about to say now. So if you're interested in this kind of video, keep watching and I'll be right back. Welcome back. So breast self-examination is a method by which women examine their breast. Breast self-examination should be done once every month, and it should be done every month of the year. That is from January to December. Breast self-examination should be done the week after your menses, after your menstrual period. Okay, remember during period there is a lot of hormonal changes, and there are a lot of changes on your breast. Your breast get engulfed, and it gets painful when you touch it. It looks swollen and all of that. So if you examine your breast before your menstrual period or when you're menstruating, you may not really get what's the right results. Okay, so you examine your breast the week after your menstrual period. Then if you're a woman who is no longer menstruating, like a woman who is in her menopause, you're no longer seeing your menses, so you should choose a day in every month that you should be examining your breast. Okay? So you can choose the first day of the month, or you can choose the last day of the month. Just choose that day so you won't forget to examine your breast. The breast examination can be done standing in front of a mirror. It can be done while in the shower, while you're taking your shower, if you have a mirror in your bathroom. You can also do it at bedtime, lying on your bed. You can also do it early in the morning when you wake up from sleep. You can also do it on the floor or on any hard surface. Okay, breast self-examination does not really take so much of your time, so you can just do it at your own convenient time. So the step-by-step guide on how to perform breast self-examination. There are two methods of examining your breast. So it doesn't mean that you can use one method and leave the other method. You are supposed to use these two methods that I'm about to mention now, but you start with the first method. Then after the first method, you go into the second method. Okay, so the first method is visual inspection or visual examination. This is where you examine your breast with your eyes alone without touching your breast. So if you have an eye problem, you can't really see your breast very well while standing in front of a mirror, you may have to tell one of your family members, a close relative that you can trust, or your partner to help you, or a close friend that you can also trust to help you examine your breast visually. You can tell your friend what to look out for while examining your breast. So this is how to do the visual examination. You stand in front of a mirror, braless and shirtless. Remove your shirt, remove your bra. Then you stand in front of a mirror and keep your two hands by the side of your body. Then you use your eyes to examine your breast. You look at your breast very well. Now let me tell you what to look at for while examining your breast with your eyes. One, you look at for the shape of your breast. If there's any change in the shape of your breast, you look at for swelling. If there's any swelling in any part of your breast, either the right breast or the left breast or the both. Then you look at if there's any dimpling on the body of your breast. If any part of your breast is going inside, if it is dimpling, okay, then you look at for any redness. If there's any part of your breast that is reddish, okay, then you look at for rashes. If there is rashes on your areola area, if there is rashes on any part of your breast. Then lastly, you look at your nipple and check if the nipple is going inside. If there's any change on your nipple, for example, nipple inversion, if the nipple is going inside or is inverted, you look at your nipple and check for that as well. Then after that, you take your two hands and keep on your waist while standing in front of your mirror. Keep your two hands on your waist, and you also examine your breast with your eyes. Look out for everything that I just mentioned now. Then after looking out for them, if there's any of them present, you notice. If there's nothing present, you also notice. Then after that, you raise your two hands up in front of a mirror. Raise it up very well above your head. Then you also look out for your breast. If one is looking so much lower than one, So if one is lower than one, it means that something is actually pulling the breast down. You note it down. But if if two of them are okay, normally one breast is kind of slightly bigger than one, so it shouldn't be so obvious. Okay, so you also check for everything that I just mentioned now. Just use your eyes to visualize your two breasts and check if there is any abnormality. Check for everything that I mentioned initially. So after checking this, we are done with visual inspection. Then the second step is manual inspection, and this is where you use the folds of your fingers to examine your breast. You don't use your single finger to examine your breast like this. You don't use two fingers. You put these three fingers together into a fold and use it to examine your breast. Okay, you can also do this manual inspection while standing in front of a mirror. You can also do it while lying down on your bed, while on the shower, and also while lying down on a flat surface. But for the visual examination, you must be standing in front of a mirror. It's those three positions I just mentioned in order to do the visual examination. For the manual inspection, first one, you can stand. So if you are standing to examine your breast, or if you choose to stand in front of a mirror to examine your breast, you will first of all examine the left breast or the right breast, one after the other. After the first one, you move to the second one. Okay, so to do this, what you will do is to raise your hand up all the way above your head. Then you use the fold of your fingers to examine. If you are examining your left breast, you use your right finger fold to examine your left breast while your left hand is up. Okay, then you use it to to palpate your breast. When you are palpating your breast, you go in gently, then to medium, then to firmness. Okay, you start gently, make it a little bit harder, then make it firm, so that you can feel your breast tissues. So when you are examining your breast with your hand, when you are manually examining your breast, what do you look at for? You look at for lumps, you look at for hard knots, you also look at for if there's any hard surface on in your breast tissue. You also look out for any pain on any part of your breast that refuses to go out, to go away. Okay, so you start. So it is good to examine your breast in a circular motion so that you don't miss any part of your breast. So what I mean by circular motion is you go like this from here to here, from here to here. You go down, you go down, you go down on the under. Then you continue on a circular motion till you get to the areola. So after examining your whole breast, you still examine your underarm, that is your armpit, because some of the breast tissues they are also under your arm. So you have to also examine your underarm to be sure there is no lump or hard knot in there. Okay, so you just examine your breast like so, just gently in a circular motion. You palpate your breast, you keep going, 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 examine until you get to your areola. So after examining your breast, then you squeeze your nipple a little bit to see if there will be any discharge from your nipple. Any form of discharge, you also note it down. So after examining your breast with your first finger, you note that everything that you observed from the manual inspection. So for the manual inspection, you can also lie down on your bed on any flat surface to examine your breast. So what you will do is to lie with your back. You do not lie with your front. You lie on your back. Lying on the bed to examine your breast is preferred for those who have bigger breasts than those who have smaller breasts, because when they are standing, they may not be really able to feel all their breast issues. But when they are lying down, their breast tissue is kind of spread out, and they'll be able to palpate it very well to feel what is going on inside. Okay, so when you are lying down on a bed or on the floor on a hard surface, what you will do, if you are about to examine your left breast, you place a pillow at the back of your left shoulder and keep your hand away from your head. Okay, just like this while lying down on the bed. Then you use your right hand to examine your breast just the way I just mentioned, in a circular motion until you get to the areola. Squeeze your nipple to check if there is any discharge from your nipple. okay? And you also look out for everything that I just mentioned now that you should look out for. Then after examining your left breast, you still do the same. Transfer the pillow to the right under shoulder. Keep your hand away from your head and also use your left hand to examine your left breast. And you also observe for all those things I just mentioned: lump, hard knot, hard surface, pain, and so on. So after doing this, when is the right time for you to call your doctor? If any of these abnormalities that I just mentioned now is present, or one of it, even if it's one, is present on your breast, it could be a sign of an infection or a sign of breast cancer. So make sure you quickly contact your doctor for further investigation and treatment if necessary. So this is how to perform breast self-examination. So if you're a lady and you've not started performing breast self-examination, I think you should start now. It is not late at all, but start now. Make it a habit, because if you're already used to examining your breast once every month, and you know how your normal breast looks like, it will be very easy for you to dictate when there is an abnormality. But if you don't examine your breast, and probably you just touch your breast and you feel something, you may not differentiate the normal from the abnormal. That is why you have to examine your breast every month for early detection of any sign of infection or breast cancer. So if you enjoyed this video, please give it a thumbs up, comment. If you have any question of any kind or any video suggestion, you can write it down on the comment section. And do not forget to subscribe to this channel and turn on the post notification bell to get notified each time I upload a new video. So thank you so much guys for watching, and I will see you in my next one. Bye.